Epilepsy is the occurrence of two or more unprovoked seizures, and a seizure is a disorder of the brain in which you have a sudden abnormal discharge of electrical activity from brain cells. And these brain cells are very small. There are billions of them. You can see them under a microscope, and they all are connected to each other and like an electrical circuit to coordinate the body's function. And if the discharges that these cells just give off to each other become abnormal, then we see a change in the body's function, and that change we see as a seizure. Epilepsy or seizures can cause a change in a person's behavior. Depending on where in the brain the seizure starts, you can have different types of seizures. So we may have seizures that are what we call generalized, coming from both sides of the brain, and these are usually associated with the person being unresponsive or unconscious. And the one that most people may be aware of is one in which a person, what we used to call a grand mal seizure or a generalized tonic-clonic seizure, in which a patient becomes unresponsive, falls to the floor, they stiffen and they have jerking of all four extremities. Sometimes they may have frothing from the mouth, and sometimes they may lose control of their bowel or bladder function. And this may go on for a few seconds or minutes, and the person will be sleepy after. We may have a generalized seizure that may be very subtle, what we call an absence seizure. And in this seizure, this lasts for a few seconds, 10 to 15 seconds the most, or 5 to 10 seconds. The patient is unaware, but they won't fall to the floor. They will remain standing, be unresponsive for the few seconds, and then suddenly come back to alertness. We may also have what we call focal seizures, which just affect one side of the brain, and this may cause impairment in a person's awareness again. It may cause a change in their behavior. They may act in a confused way, or sometimes they may have jerking just on one side of the body and be totally aware of the seizures. So you may have different types of seizures depending on where in the brain the seizures start.